Hello, everybody. Welcome to MIO Podcast. I'm your host, Dr. Suresh Rao. I'm a senior oncologist and director at MIO Pompel. It's a specialty cancer hospital at Mangalore. Today, I thought I will discuss four important cancers very briefly so that you can know the symptoms and warning signals of this cancer and also know the enormity of this disease and also to know what is the simple treatments that can be done. So basically, I will talk about breast cancer. That is also very common in the West and in India also now it is one of the most leading causes of death. Then we'll talk about cervical and uterine cancer. So two cancers mainly in the women, that is breast and cervical cancer. Okay, next we'll go to breast cancer. Again, same pattern in breast cancer. Incidence, death, symptoms, treatment, survival, prevention, and screening. So, first we'll go to incidence and death. Worldwide, there are 2.3 million new cases per year. That means 23 lakhs. Deaths are around half a million, more than half a million, 670,000. So, more than half a million people die because of breast cancer worldwide. That means around one death every zero point 0.8 minutes, 75 deaths every hour worldwide. In India, the number of new patients of diagnosed of breast cancer is around 1,92,000, around maybe 2 lakhs. And you have 98,300 deaths per year. That means one death every 5.2 minutes in India. So again, breast cancer is a major problem. And generally before it was only in the West. Today it is even in India, very common problem that we see. Next, we'll go to symptoms. What are the symptoms of breast cancer? That means what will the patient feel? Symptoms is what the patient tell the doctor. Sign is what the doctor feels and put as part of his findings. Now, symptoms of breast cancer. Early, you may get a painless lump in the breast. So, all lumps are not breast cancer, but generally, you will feel that a painless lump. So, there won't be pain. Again, I'm telling you, there won't be pain. Initially, there won't be pain. So, painless lump. So, or sometimes thickening of the breast skin. So, thickening we say. So, when you compare one breast with other, there may be thickening of the breast. Change in breast size, shape, and color. So normally there will be sometimes already there will be some difference in say shape and size of the breast. But if there is a sudden change in shape and size of the breast and color, then this is one of the symptoms. Change in skin over the breast, dimpling, puckering, or redness. Skin changes. So it will like orange peel. So some things like that is seen. Puckering we say. So that is another symptoms. Nipple discharge or nipple changes we say. One is retraction of the nipple. That is nipple goes inside. Retraction we say. Or there is an ulcer on the nipple or scaling on the nipple, dry. Then discharge, maybe mainly blood stained discharge coming from the nipple. So this is another important thing. So now what I want to tell you is a lump can be non-cancerous. Discharge from the nipple also can be infection. But after 40, if you see any of this, then you have to think it as a warning signal or symptom of breast cancer and you have to check with the doctor. When the breast cancer becomes advanced, you will have a stony hard mass or there will be an ulcer. This is advanced. But early is painless lump, skin changes, change in shape, change in color of the breast. So, and nipple discharge. These few things, if it happens 2 to 3 weeks, please don't ignore it. You show the doctor if it is benign or non-cancerous, be comfortable, but continue to monitor. Again, this is a long process. All cancers, you should not do one day and say, okay, doctor has told me everything is normal, so I am comfortable for the next 10 years. No. So, it is a continuous process with patience and you have to look after yourself that way. Next, we'll go to treatment. So there are different kinds of treatment in breast cancer. One we say is breast conservation surgery. That means you don't remove the whole breast in early breast cancer especially. You remove only the tumor and some margin and remove some lymph nodes in the axilla. That's called breast conservation. Or you can do mastectomy, remove the whole breast in early stages. So this is the choice of patient. There won't be much difference in survival. Some people tell, sir, we don't want this headache of cancer coming again in other part of breast, so remove the whole breast. It happens in America everywhere. It's not just like in India. European countries also happen. Some people say, I don't want this breast conservation. So it is your choice. So the surgeon or the oncologist will offer you. So if it's a small lesion, I need not remove the whole breast. Second form of treatment is radiation. That is means high energy X-rays. So today radiation is very safe treatment because we do it with CT scans and all. So it's a safe treatment. Next is chemotherapy. That is cytotoxic drugs. So they are given in different stages of breast cancer. Depends on various factors, but plays a very important role. And even in stage one, sometimes chemotherapy may be given because of the risk factors if it is high risk. So next is hormonal therapy, that is tablets. So or injections. Then there are tablets we can give for from 5 to 10 years. Then we have targeted therapy, that is called what is known as HER2 receptor. If it is positive, then a drug called trastuzumab is given for 1 year. So these are the main treatments: surgery, breast conservation, radiation, chemotherapy, hormonal therapy in the form of tablets or injection, and targeted therapy, what we call as HER2 receptors. When it's positive, you give. Then there is also immunotherapy, pertuzumab we say. So that is also given sometimes in breast cancer. These triple negative breast cancers are little more aggressive, and breast cancer in young patients also a little bit more aggressive. What we call luminal A, luminal B, then hormone sensitive, and triple negative. We divide it actually into four groups. So it's not only the stage, it's also the biological behavior of the breast cancer which decides the treatment. Next, we go to survival of breast cancer. So, what is the advantage of coming in first stage? So, survival in first stage is almost 100% cure. Actually, first stage when you say it's less than 2 centimeters, if it is luminal A, it's almost 100% cure. Stage 2, it drops to 85%, but still 85% will be cured. That means out of 10, almost 8 to 9 people will get cured. Third stage, it drops to around 58 to 60%. That means out of 10 people we see breast cancer in third stage, only 6 will be cured. 4 will at some point of time fail. And in stage 4, maybe 15 to 20% will have long-term survival. That means sometimes if it is biologically good cancers, even stage 4 can survive up to 15 years. So you should not get afraid. So doctor has told me it is stage 4. If it is a hormone sensitive, even with lung mets, when it's spread to lung, people can survive 10 to 15 years. And it's a very long time they can survive. So biology is very important in cancer. Triple negative breast cancer has a bit of poor prognosis, we say, because they are very aggressive. So next we go for prevention. Can we prevent this breast cancer? Mostly it is a lifestyle modification, very important. Maintain healthy weight, prevent obesity, that is again very important. Regular physical activity, you have to be active. Healthy diet, limit alcohol intake, and last, avoid tobacco use. That is what many important things we have to do. Plus, next is reproductive and hormonal factors. These are also important. Breastfeeding reduces the risk. So, it is very important to breastfeed, uh, which will reduce the risk of breast cancer. Limit hormone replacement therapy. So, especially estrogen only therapy should be avoided. Avoid unnecessary OCP, oral contraceptive pill. Avoid this. And sometimes we say that there is chemo prevention by drug called tamoxifen or relaxifene. These are also recommended sometimes, not very popular although. Then, if the family history there is a breast cancer, sometimes BRCA1, BRCA2 mutation is there. Even prophylactic surgery like mastectomy before cancer comes, if there is very high risk, that is if BRCA1 2 is positive, you can remove the breast, or prophylactic oophorectomy, ovary can be removed. You would have known or read many very popular film stars and popular persons have undergone prophylactic mastectomy after they have found BRCA1, BRCA2 mutations. So very important that prevention is a important role. It plays important role in reduction of breast cancer. Next is screening. Screening is for normal population, like people with no symptoms. So for them, most important is breast self-examination. You should learn how to do breast self-examination. Normal look and feel, what we call. Then is clinical breast examination performed by doctor. So that also has to be done. So maybe it's every 3 years after 45. Breast self-examination every month. You should start it at 40 and sometimes even early, maybe even at 25 for those who have family history. There are a lot of guidelines for that, but generally every month after the periods, after 7 days when the breast is soft, breast self-examination has to be done. Then generally what we say is every 1 to 3 years, 25 to 39 years, every year after the age of 40, doctor's examination we say. And mammography, low dose x-ray, that is an x-ray taken of the breast. It's a very low dose at age 40 to 45 years. Then we say you can do it every 2 years. So of course depends on risk factors. So at least every 2 years you have to do it. And sometimes we ask for ultrasound or MRI of the breast in high risk patients like BRCA1, BRCA2 mutation is there. Then we ask for ultrasound or MRI also. So these are all high risk when there is genetic mutation. It's very small percentage, but it has to be done. Now we'll go to another important cancer, that is cervical cancer. So again, we go in the same format: incidence, death, symptoms, treatment, survival, prevention, and screening. Let us see the incidence and death. Incidence is what are the new cases we say. Per year, how many new cases we are seeing. Worldwide, it is almost 660,000 new cases, more than 500,000 new cases worldwide. Global death is around 350,000 per year. So 90% of new cases and deaths occur in low and middle income countries. So this is, you should remember that cervical cancer is in Asian population or in low and middle income countries, African population. So 90%. So India we see around 1,20,000 new cases every year. So every year we see that many number of patients and 77 deaths annually. That means one woman dies every 8 minutes due to cervical cancer in India. So again, because of that, the problem becomes enormous. So this is incidence and death. Next, we go to symptoms. What are the symptoms of cervical cancer? Abnormal vaginal bleeding. It's very important. And this cancer also generally comes, after 45. So, but even then, you have to look once it is you are above 40. The women should see what is the problem, and they should try to diagnose it early. Abnormal vaginal bleeding, that is between menstrual cycles. One, so you have 4 days of menstrual cycle every month, 4 days of bleeding. So if it is in between, like in between, you have some bleeding happening, intermenstrual bleeding, we say. And after that, if you have bleeding after sexual intercourse, postcoital bleeding, we say. Then any bleeding after menopause. So once you have menopause, that is maybe at 48, 50, 52, and if there is any bleeding, spotting, then you have to take it as a very important symptoms of cervical or sometimes endometrial cancer. Then you may have pain in the lower abdomen. That is also very important. Once the cancer develops in the cervix, you will have pain in the lower abdomen because it will irritate the bladder. There are nerves, there are ligaments, all that you will start developing pain. Then you will get discharge, which may be foul smelling discharge. This is again a symptoms of cervical cancer. Now you should remember that this intermenstrual bleeding, all this can happen in non-cancerous condition also, like discharge can happen in candida, infection, all this. But cancer is one of the important causes, and we should not miss that. So we should not get worried, but it is that when you have these symptoms, you have to ask the gynecologist and ask her to do a pelvic examination, and they will examine and see. So it's very easy to diagnose. Again, this cervical cancer takes 20 years to develop. Next, we go to the treatment. What is the treatment of cervical cancer? Early stage, that is stage 1 and 2, surgery plus minus radiation. Sometimes we give radiation also as the only treatment, or mainly it is surgery for first and second stage plus minus radiation. When it is third stage, surgery is not possible, so give what is known as concurrent chemo radiation. Radiation and chemotherapy given together. So radiation is given in two ways. It is given from outside, that is called external beam radiation, and second, after that is completed, we give what is known as intracavitary radiation, ICR we say. So together, chemo plus radiation. Once it is fourth stage, it is palliative chemotherapy. So these are the main treatments: surgery, radiation, and chemotherapy. Next, we go to survival. Suppose somebody comes in stage 1, what is the cure? And what is the cure in or control in stage 4? In first stage, 80 to 90% get completely cured. Once it comes to stage 2, 70% get cured. And when it's stage 3, it drops to 40 to 50%. And stage 4, hardly 15% make it up to 4 years. So this is the survival pattern as per stage. Next is, can we prevent it? Prevention. So prevention is there for cervical cancer. HPV vaccination recommended for girls aged between 9 to 14 years, can be given up to 26 years. There is a vaccine, it's called Gardasil, and there are different companies, but vaccine is given 3 doses. So that is to prevent HPV vaccination. So 90% is because of HPV. So that is one important thing. Then safe sexual practice, condom use, delaying onset of sexual activity, reducing number of sexual partners. This is one of the method to prevent the occurrence of cervical cancer. Next is lifestyle. This also plays a role in cervical cancer. Avoid smoking, maintain good genital hygiene, and good nutrition, vitamin A, C, and E. So all this plays a role in prevention of cervical cancer. Next is there screening. Screening, again I told, it is for normal population with no symptoms, women. So cervical cancer is preventable as precancer lesions develop from 10 to 15 years before invasive cancer. That means you get a precancerous lesion, almost 10 years it takes to become invasive. Screening, what are the screening methods available and what are the intervals? So you can do HPV DNA test every 5 years. You can do Pap smear cytology every 3 years. Co-testing, that is HPV and Pap smear, if you do, you can do every 5 years. And there is what is known as visual inspection with acetic acid, which can be done every 3 to 5 years in actually where there is low resources. So all these screening methods will help us detect if there is cancer or 10 years before actually it develops. So you can completely see that this cancer problem of cervical cancer completely cured. In conclusion, now we have talked about 4 cancers, that is head and neck cancer, colorectal cancer, breast cancer, and cervical cancer. These are very common cancer. And I feel that if you are very observant and once the symptoms come, if you come within 2 to 3 weeks, all these cancer can be diagnosed in first or second stage, and as I told you, 90 to 100% curable. Again, I would like to remind you that in western societies, 80 to 90% of these cancers are diagnosed in first and second stage, and in India, unfortunately, most of them come in third or fourth stage. So we have to see that we come in first or second stage because the success is very high. I want all of you to be very vigilant, and because cancer is a disease which is very difficult to treat once it is in advanced stage, and if it is first and second stage, it can be completely cured. And only thing is, we cannot blame the doctors or the health sector for delaying the diagnosis, because if you come late, nothing much can be done. So we have to be very intelligent, we have to be very curious, and any symptoms, please don't take lightly. There are multiple signs and symptoms which can be helpful in diagnosis cancer in first or second stage. So I request all of you to be wary of these symptoms and take care of your health, modify your lifestyle, and respond to these calls from your body, and meet the doctor as early as possible. Thank you.